Do you have any idea as to, as a whole, how we're doing as a country, and perhaps some models as to when this may peak?
No, I don't think you can have models. There are a lot of models. We discuss them on the clinical epidemiological discussion group that I mentioned, but it's much too early to be talking about a peak. I think today we reached 85,000 cases, which means we have more cases in the United States than China had. So we are the epicenter now of the outbreak. And obviously, when the virus will peak will depend on how much people socially isolated. I need to put a plug out. It's critical to socially isolate. Actually, physically isolate's a better word, because it's better to be in social contact with other people through computers, through telephones, but to remain physically isolated. Well, the biggest failure is we didn't do early testing, so we don't know how much of the rates are due to artifacts. We don't know even the simple sensitivity and specificity of the tests we're using because we aren't testing enough people. So it's very hard to tell. There's an exponential growth in cases, whether there's a separate parameter for New York City or just farther along on the exponential growth. My guess is they're just farther along on the exponential growth. It's said to double about every 3 days, the number of patients. In California, I've just seen reports, epidemiologists say it's down to every 8 days. In New York City, I think it's even less than 3 days. Part of the problem is the CDC has given us no leadership on this. In past epidemics, CDC has always been the leader. We've always trusted what they've said. And suddenly, my friends at the CDC say that they need to be careful not to say anything that is against their secretary or current administration, or they fear for their jobs. So they're being amazingly silent. And I've heard nothing from the director of CDC whatsoever on the outbreak.